invite Dr. MEENA GOPINATH MENON to talk on new anti-glaucoma medications in pipeline.
Good morning.
Dr. MEENA is the glaucoma consultant in Shankara Eye Hospital, Bangalore. She did her MS from Aravind Eye Hospital, Madurai, and took her FRCS in 2001. Over to you, Dr. MEENA.
Thank you, Dr. Girija. Thank you, KSOS, for giving me this opportunity. So my half job is done by Litta and other speakers. So anti-glaucoma medications have gone through a lot in past 20 years, starting with new single drug, fixed combinations, and some of them are the newer addition to these armamentarium. Some are already existing. So when we talk about pharmacological agents, I'm like slightly modifying the title. It's not only in the pipeline, it's already available. ROCK kinase inhibitors, it has been dealt already. So I'm just going through a little studies which are conducted about the ROCK inhibitors. So ROCK inhibition usually relaxes the trabecular meshwork, it increases the outflow. And norepinephrine transport inhibition also reduces the aqueous humor production, and it lowers the episcleral venous pressure. Now, there are certain additional benefits with this group of drugs, being protection of trabecular meshwork cells from oxidative damage, it facilitates corneal endothelium wound healing, it increases the ganglion cell survival, and there have been few literature which shows that there is a reduction in bleb scarring in glaucoma surgery. But being some of the downside is it's not effective in angle closure glaucoma, and it can worsen uveitis, and the main side effect being conjunctival hyperemia. Now the prototype, one of the drug is Ripasudil 0.4%, which is being used for open angle glaucoma and OHT, which gives a 15% IOP reduction, but as you can see, it's got a very high rate of conjunctival hyperemia. The other drug being Netusudil, it is given as a once daily dosing, which gives a 22% IOP reduction. And again, it has got various mechanisms like aqueous humor outflow is increased, reducing the EVP and reducing the synthesis of aqueous humor as well. The conjunctival hyperemia in this group is almost 53%. Other side effects being cornea verticillata and conjunctival hemorrhage. When we talk about cornea verticillata, what is it? It's basically lipid microdeposits in the corneal epithelium, which is due to phospholipidosis. Now, usually this resolves. Once you stop the drug, it usually resolves in 13 weeks, and it doesn't cause any change in visual acuity. When we talk about the conjunctival hemorrhage, it is usually seen sporadically, usually in the limbal area, unilateral most of the time. Small microhemorrhages are seen. This is one very common side effect which we see day in and day out after we started using this group of drug, called as honeycombing. This is basically a reticular epithelial corneal edema, which is usually seen with the use of either Ripasudil or Netusudil. Most of the time, this is seen with the patients who have already existing corneal endothelial problem. So basically, this group of drug is a double-edged sword. Even though they say that corneal endothelium is protected with this drug, but sometimes we do find this side effect very commonly. Some of the studies, landmark studies, Rocket 1 and Rocket 2, wherein they compared the Netusudil with Timolol maleate, and they found that it is statistically non-inferior to Timolol. The other group, other drug in this group is a combination drug which at present is not available in India, that is Netusudil with latanoprost combination, but unfortunately the ocular hyperemia is quite high in this drug. The landmark trials being Mercury 1 and Mercury 2 trials, wherein they found that this fixed combination when compared to monotherapy with Netusudil or latanoprost showed a promising result. Now we are all with this tag. This is the world's first fixed dose combination of brimonidine, timolol and brinzolamide, which has been brought in India, which is called as TriSop, no financial interest. And this is the other study which I have been fortunately to be a part of it, but still it is not at FDA approved, which is bimatoprost, brimonidine and brinzolamide. It was a multi-central trial all over India. Some of us might be a part of it. Most of the organizations were part of it, but it's still it is published in clinical ophthalmology, but is still not approved. Other group of drug which is in pipeline is nitric oxide donors or prostanoid receptor agonist, which has got all kind of properties, like it helps in neuroprotection, it decreases the IOP and increases the blood flow as well. Now, in this group, the drug's name is latanoprost bunod. It is currently not available in India. It's marketed as Vysutla, 0.024%. It is given as a once daily. Now, this is usually metabolized into latanoprost acid and butanediol mononitrate, which is, so it helps in all the pathways, uveal scleral, conventional outflow, all this is helped by this particular drug. Now, the Apollo study is the landmark study of latanoprost bunod, where they compared with timolol maleate in patients with open angle glaucoma or ocular hypertension, and they found that once a dose of latanoprost bunod, when compared to twice daily timolol maleate, mean IOP was significantly lower in the LBN group. The other study is the Luna study, wherein they compared the same latanoprost with timolol maleate. Now, in this group, they had a placebo group also. So, they found that definitely this is non-inferior to timolol and safety is good. Again, this was one of the primary studies wherein they found the long-term safety and efficacy of latanoprost in Japanese subjects, which is called as Jupiter study. So again, it was a multicentric trial which they gave the drug for almost 52 weeks. It was evaluated every 4 weeks for the safety, and they found that the mean reductions was significant, almost 22% and 19.5% was achieved by 4th week. So it is safe and well tolerated. In Japan, it is very well available in the market. Now, all these studies are very interesting names. This is a Voyager study wherein they compared latanoprost bunod with latanoprost. All this while we were talking about latanoprost bunod with timolol. Voyager study compared with latanoprost, and they found that a significantly greater reduction in mean diurnal IOP, because that's one of the worry which all of us have. So this definitely considered the mean diurnal IOP also. The other is a constellation study wherein again they compared latanoprost bunod with timolol in controlling the pressures over 24 hours. So this also they found that this is non-inferior and it controlled the diurnal as well as the nocturnal IOP. This is the other drug which is already available in Japan. It is called as omidine PAG isopropyl. It is an prostanoid EP2 receptor agonist. Now it increases the aqueous humor outflow, and some of the side effects being conjunctival hyperemia and corneal thickening has been noticed in these children. The other group is oligonucleotide based compounds. Most of them are in clinical trials. As you know, pegotamine and already being used by the retinal surgeons for NVG, aganirsan and bimosiran are in the clinical trials right now, mainly for NVGs. Neuroprotection, we always talk about this neuroprotection. There are various drugs which are being used, neurotrophins, glutamate antagonist, calcium channel blockers, nitric oxide inhibitors, antioxidants. This shows different pathways where it acts in as an anti-glaucoma drug. Now, just a word about drug delivery implants. So these are not currently available in India, but it is hugely being advocated all over. So one of the common one which is FDA approved is Durista or bimatoprost implant, which is available as a 10 microgram. That is what is FDA approved. They were doing clinical trials with 10 and 15. Now, this study is called as Artemis 1 trial, wherein they compared Durista of 10 microgram and 15 microgram, and they found that it is definitely non-inferior to 0.5. Now, how does it place? So, this is like a DEX implant wherein you have an injector and it is placed at the anterior chamber angle. So, this is what you can see as an implant which is placed in the anterior chamber angle. Now, what is the main concern? Main concern was drop in corneal endothelial cell density. Rarely patient had conjunctival hyperemia, foreign body sensation, but the main problem was cornea. The other being bimatoprost ring. So, this is a small ring, polypropyl ring, which we place it in the limbus fornices, upper and the lower fornices. The other one is, which is the pipeline. This is really in the pipeline, travoprost punctal plugs. So it is placed in the punctum and it has got a filtered light. So we will know whether the device is in the punctum or not because it contains fluorescein. So iDose travoprost is again placed in the trabecular meshwork as an implant. So this is a study which is a very well written study, Newer Advances in Medical Management. From this I have taken this chart wherein they have enumerated what are the ones which are preclinical, ongoing clinical trials and which are already in use in clinical practice. Thank you.
Thank you, Dr. Meena. That was an excellent presentation. Most of us are not familiar with these drugs that you mentioned in your presentation, but it just gave us an idea about what all are coming. So we have hope for newer drugs in the future. So thank you very much. So this will bring us to the end of the session.